I would like to welcome the ACS members to the American College of Surgeons Pathways to Fellowship interview series. I'm Lindsay Kilgore, a breast surgical oncologist at the University of Kansas Cancer Center, and I'm an associate fellow member of the American College of Surgeons and the current vice chair. The committee has developed this new fellowship interview series to spotlight surgeon leaders who have championed the pathway for fellowship for young surgeons. The goal of the interview is to help promote the value of fellowship within the ACS and among its members, especially those in subspecialty fields of practice. This interview will be published in the Resident and Associate Fellow newsletter and will be made available as a podcast accessible from the ACS website. Joining me in conducting this interview today is a medical student committee member, Quinn Losevsky. Quinn, could you please introduce yourself?
Hi, I'm Quinn Losevsky, a medical student at the TCU and UNTHSC School of Medicine in Fort Worth, Texas, and I'm a member of the American College of Surgeons.
Great. Thank you for joining us. I'd like to begin the interview. So let's have you tell us a little bit about yourself. Dr. Roser?
Great. Thank you. Thank you, Lindsay and Quinn, for the opportunity to join you tonight talking about some of my very favorite subjects. By way of background, I'm chair of the Advisory Council for Oral and Maxillofacial Surgery. I've been a fellow of the college since the 90s. I'm very pleased to have been a fellow for much of my career. I'm at Emory in Atlanta. My interests are maxillofacial trauma and facial reconstructive surgery.
Wonderful. Well, we are honored to have you with us. So thank you very much for joining. And Dr. Manahan?
My name's Michelle Manahan. I am working at Johns Hopkins in Baltimore as a plastic surgeon. I'm our department's vice chair of faculty and staff development and well-being. And I, like Dr. Roser, joined the ACS pretty much as soon as I could and have been a fellow since I applied and was happy to be accepted.
Well, thank you also for joining. We're honored to have all of you. So let's go ahead and get started with a couple questions that we have for you. What does ACS fellowship mean to you and to your institution?
To me, being a member, a fellow of the ACS means being part of a larger group. I really believe that physicians, surgeons, surgeon specialists need to have a voice as we work with our patients, as we work with external agencies who impact our ability to provide healthcare. And I think that by coming together and having a conversation, we're able to strengthen our voice. And to me, that's really the value that I look to as a member of the American College of Surgeons. For the institution, I think it also helps us become one with those around us. We do things on our own at our institution, but we are part, just like being a member of the larger group, we are part of a larger network of healthcare providers. And I think that helps us all just stay linked together and helps us work together and learn from each other.
I feel the same way that Michelle. It's the term that's being used now, it's the house of surgery. And getting together and sharing best practices, advocacy for surgery is absolutely critical as we go into this next era of healthcare delivery. The local chapter, the Georgia chapter, Georgia Society, is a great meeting. We get together with all the folks in rural Georgia and listen to their stories. We have a lot in common, and I'm proud to be a fellow in the House of Surgery.
Very well said. Thank you.
On to our second question. How has the affiliation with the ACS helped your career path and helped you as a specialist?
It has just helped me better understand my role and the role of everybody I work with. I think particularly in plastic surgery, we do so many cases, so many things with other groups within surgery and even outside of surgery that we are constantly linked together. So having an ability outside of each clinical interaction to be able to get together, to be able to, like Dr. Roser said, share stories and just talk about the stuff that happens on a day-to-day basis. Countless numbers of times I have been in a conversation with somebody at one of the ACS meetings and just casually something comes up and it's oh gosh, such and such, such and such. And then the response is, hey, yeah, me too. It really makes you feel good to be part of something bigger and also to be part of something that other people experience as well. So it just has been invaluable to me. I love going to the meetings. I love participating in the committee stuff. I just love any opportunity to really get to know the people who I share this wonderful job with better.
Great. Again, I echo everything you've said. And I would add Operation Giving Back. I was there when Operation Giving Back started, and that's the global surgery office for the American College of Surgeons. I have an interest in global surgery, and this has been it's been important in my career because I didn't come up through public health or any of the usual epidemiology speak tracks. And so I've had to learn things on my own, but it's the American College of Surgeons that brought me into that venue. Michelle said something that really resonates. Came up at a breakout room that the college had in their diversity, equity, inclusion seminar recently. And it turns out stories have historically always been the way that we have passed on what we know. Going to these meetings, what's the best part of it? Stories with friends.
How have each of you championed ACS fellowship at your institution and within your specific subspecialty?
I think we pushed hard to get folks to come to the Georgia Society meeting and pushing the residents to submit abstracts and submit posters. And there's so many opportunities. The Young Fellows Association, RAS, getting everybody involved. There's a place for everyone.
I would also say that in addition to the formal mechanisms, I think there's every opportunity to, in casual methods, also highlight the value of being a fellow of the ACS. Or when we're just in the operating room, having a conversation again about, what went on earlier in the day or something like that, there is every opportunity to bring in the resources and the tools and the opportunities that the ACS provides. To me, it wasn't something that I really needed to think about and convince myself of, because all of the role models that I had when I was a medical student interested in surgery and when I was a resident doing surgery, all of the surgical greats who were walking around doing amazing things and who had a history of doing amazing things had so-and-so MD FACS on their coats. So from the very beginning, from the first week of being on the wards as a second-year medical student doing my first surgery rotation, I saw that and I somehow internalized that was what you needed to have if you were going to be a surgeon, MD FACS. That was kind of a goal as I went through training to achieve what those who had come before me and who I admired had achieved. This is what those who do a good job are doing.
Again, I echo what Michelle said. The people that were my role models early on were people that have been in leadership positions in the college. I had the opportunity to train at Mass General Hospital that has had a lot of leaders and a lot of college leaders. And for me, it was a sort of a natural progression to do that. Like Michelle said, it's what you did. You were vetted. You were vetted on paper. You were vetted by recommendations. You were vetted with an interview by people who were very careful about who they wanted to let into the college, and rightly so. It sort of validates what we all internalized as a pathway.
I think you guys make a great point. I'm an associate fellow, and so I'm in the application process now, and that FACS is something that you've always desired. And by having leaders and mentors like yourself, especially within plastic and, reconstructive surgery, showing them that FACS still matters and leading by example, I think that you guys are the reason why we'll recruit more people to the college. So thank you. So I've got one more question for you. What are 3 takeaways for our surgeon colleagues on how they can address their career path and membership in ACS?
The 3 takeaways are that I want you to be a leader. Wherever you go, I really want you to be a leader. I want you to be a leader in the profession. I want you to be a leader as a citizen. I want you to be a leader as a role model for others. The college gives you an opportunity. I mean, if you look at the Young Fellows Association, there are a lot of leadership opportunities. You look at RAS, there are a lot of leadership opportunities. So one takeaway is this is a good place to learn how to be a leader, because the leaders, movers and shakers in surgery are there. I think the second takeaway for me is it is a powerful resource. There are people that are so smart at the college that know what they're doing and how to deal with issues and problems that you have on a local level, so you're never alone. The third, I would say, is the clinical congress is really a good meeting. It's as robust and as rich, and you can learn a lot at the college meetings if you try.
I have to just go with one bottom line. What I would suggest would be that I think the best path to career development is to really continue to do what drives you, what you love, what brought you into the profession in the first place. And whether that's working on the patient experience or working on safety or working on new surgical techniques or whatever it might be, go for it. But the corollary to that is it's very hard or harder to do things by yourself. So there are for sure other people out there who have the same interests, who have the same driving passions. The college can help you find those people, and it can help you partner with those people and achieve what you want to. So hopefully when you're looking back at the end of a long, fruitful career, you can feel that you really have made a difference in the world around you, which is, I think, why we all ended up in medicine in the first place. We wanted to make a difference. So however that difference is going to be made, I really do believe the college helps you find the people who will help you do that.
That's wonderful. Thank you all so much for your wonderful insight. I think that you guys have great perspectives for our listeners who are watching this. So thank you again. We really appreciate it. Thanks.